Israel is launching a new $120 million research hub aiming to transform the future of medicine. Bar-Ilan University and Sheba Medical Center are joining forces to create Health Tech Valley, an institute dedicated to 3D printing of organs, tissues, and AI-driven data analysis, as well as medical robotics and genetic engineering. Bar-Ilan University President Professor Aryeh Zaban says the project reflects Israel's booming biotech sector, which has drawn billions of dollars in investments in recent years. The high-tech campus, located next to Sheba and close to Bar-Ilan, will feature cutting-edge labs and research hubs, while also partnering with global health and technology leaders. Joining us now via Zoom from Bar-Ilan University is Professor Shulamit Michaeli, the academic head of the Health Tech Valley. Good evening to you, and a very big news.
Yeah, these are really great news for a very, very special project, the first in Israel, that is going to combine research from Bar-Ilan University and the Sheba Medical Center, as well as acting as a hub for startup companies that will be initiated from both these institutions and others, as well as a representative for pharma, from lawyers, the patent lawyers, and the government. And this is really unique because there is nothing like that yet in Israel.
So we know Israel, the startup nation. I mean, the whole idea has kind of, been more on the slow burn. Startups are still happening. We're not hearing about it as much because of, the ongoing war. But explain, what makes this particular niche of biology, biotech, 3D. Why is this so important for future of medical care and science?
So what is really the unique opportunity here is being very close to the bedside and being able to experience and evaluate patients and taking samples from patients and understanding what is in the real life and combining the basic with the actual bedside problems. And close proximity between the academia and the medical patients is what's going to make a really big change, and also to recruit the best and the best that will join this wonderful new venture.
And with the momentum with AI, et cetera, how is this such an important aspect in the world of doing the 3D printing of organs? I mean, we have heard a little bit about it, but clearly this is the future. Tell us why.
The future is because, as you know, sometimes we need to replace organs. And for instance, if we want to treat diabetes, the pancreas is not working. So what is really best is to make a new pancreas from the cells of the same human being. So basically, it's taking cells and reverse engineering them to become pancreatic cells that can secrete insulin. And this must be secured within devices. Otherwise, the body will attack it because basically, in diabetic patients in type 1 diabetes, there are antibodies that kill these cells. So it's only bioengineering and very sophisticated regenerative medicine that make this miracle working. And so this is the new hope for medicine.
For the future, yes. And, also, how soon can we see these things being implemented? We know there is so much going on. There's a process. Some things will probably need clinical trials and, all of this and all of that. We know that it's a long process. I'm sure every vertical and every sphere is a bit different. But realistically, when can we see some of these being implemented for real?
So, for instance, we are working on genome editing to repair mutations. For instance, the baby that are lacking immune system. So this is basically working already in the United States. Several mutations were repaired already. We have to know that for any medical invention, there is the FDA approval, and it takes time.
Thank you, Professor. We're out of time. Thank you so much.